Hello again. I read today the most extraordinary statement by a spokesman for the Department of Health and Social Care. It was so peculiar that I had to read through it a couple of times just to be quite sure that I was not muddled up and that it really said what I first thought it did. Here is the statement, and it refers to a certain type of service or treatment for children and young people being delivered by the National Health Service. I will explain what service this refers to later, but that really is irrelevant. It could be cancer services or anything at all. Let me read out what the spokesperson said. The NHS is reforming this service to ensure safe, evidence-based care for young people. Now, by implication, of course, before these services were reformed, they must have been unsafe and not evidence-based. Otherwise, they would, of course, been into reforming them. So they're going to make them safe and evidence-based now because they weren't before. In other words, this is an admission by the government department in charge of the NHS that young people have been provided with treatment which is unsafe and for which there is no evidence of either its efficacy or safety. You would think that a sensational confession, really, but nobody seems even to notice it, which is a sign of the times and shows what a mad era it is in which we live. The reason that nobody seems to be taking much notice of this is, of course, that it concerns the subject of sex changes and gender identity. For some years, clinics run by the National Health Service were prescribing puberty blockers to children so they wouldn't go through puberty and acquire these secondary sexual characteristics appropriate to their sex. For example, little girls would not grow breasts or go through the menarche. Boys would find that their voices didn't break and their genitals remained very small, kind of thing. This was being done not for medical reasons, but due to some weird desire of certain medical professionals to play along with the fantasies and passing delusions of children and teenagers who claimed against all the evidence that they really belonged to the opposite sex. Of course, these drugs had previously only been used to treat genuine illnesses, and nobody had any idea at all what their effect would be when used on healthy children. This was not evidence-based medicine, and nor can anybody say if these experimental procedures were safe. If all this sounds like something which Dr. Mengele might have got up to, then yes, that is perhaps a fair comparison. He too experimented with sterilizing young people. This then is the context for the statement made by that spokesperson for the Department of Health and Social Care. It was an open admission that children and young people have been subjected to treatments which were unsafe and for which there is no evidence-based justification. Thousands of children have been experimented upon in this way in this country, and in the coming years we'll probably be able to see what the long-term effects of this craze have been. For now, though, we are left to reflect upon the fact that the NHS makes no secret about the fact that their mad enthusiasm for sex changes for children have led to their using unsafe drugs for no clinical reason, which is pretty terrifying. In the description to this video, I give a link to the news item in which the spokesperson for the Department for Health says this.